Greeting to all. I, Dr. Sachi Kinariwala, am here to take you through a case which was solved solely with the personal evaluation method. A 49-year female came to clinic with her daughter with a complaint of non-healing diabetic ulcer since 1 year. It's a known case of type 1 diabetes since the age of 7 years. There is an ulcer. It is located on the posterior aspect of right leg. There is a severe itching, which is aggravated at night. Patient is telling me that मैं नींद में ही खुजा देती हूँ, मुझे ही नहीं पता चलता. There is a severe pain. Patient cannot do anything. She's constantly telling me कि मुझे दर्द हो रहा है, मुझे दर्द हो रहा है, मुझे दर्द हो रहा है. She's like मैं कुछ भी उसको पूछती थी, she's constantly complain कि मुझे दर्द हो रहा है, मुझे दर्द हो रहा है. ठीक है? It's not like a irritating way, but we can see the pain is on her face. It is so much so pain. The another complaint is blood sugar level. Since 1 year, what is happening? That there is an extreme fluctuation of blood sugar. It goes from 50 to 300 in a same day. And because of that, there is a lot of fainting happen. There is a severe weakness. Patient cannot get up from bed. There is a breathlessness happen. Her daughter is telling me that डॉक्टर ऐसी हालत हो जाती है कि हमें लगता है कि इनको तुरंत हॉस्पिटल ले जाना पड़ेगा. That is her another complaint. Now the life history. 49 years, female. She is a widow. On observation, we find it out that I can see that she's look very naive. She look and talk in very naive way. Childhood, Punjabi family. She come from Punjabi family. She is the 7th child of her house. Last one. All brother and sisters are quite elder than her. So she is treated as a papa's princess. She described her childhood like, घर में मैं सबसे छोटी थी. पापा मुझे बहुत प्यार करते थे. मुझे कुछ मांगना ही नहीं पड़ता था. ऐसे ही सब मिल जाता था. खुद ही सब मिल जाता था. So what happened at the age of 7 years, when she is playing, she heard a news that her father is in hospital and the father having heart attack. And when she heard the news, she immediately feel that there is a breathing issue, there is a dryness of mouth, and she fainted. And this kind of episode now recurrent happen till age of 16. And another complaint during that point of time is there is a boil happen, a recurrent boil happen at the urinal portion, and there is a breathing issue and fainting. So the diagnosis is it is a type 1 diabetes. And now since then she's taking allopathic medicine for diabetes. There is no family history of diabetes in this case. So my question to her is, what does the father mean to you? Father is very important in this whole case, in her life. So while telling about her father's death, she cried like as if it is happening right now to her. I'm not so much attached with my mother as a child. मेरे पापा बहुत अच्छे थे और वो सबको प्यार से बांध के रखते थे. उनकी सोच यही थी कि जो कोई भी हो अपने साथ हो जाए. उन्होंने सिर्फ प्यार ही बांटा है. I'm totally depend on my father. married life. At the age of 20, she married to a 10 years elder person. It's a love marriage. और उसको ये लगा कि ये बंदा एग्जैक्टली मेरे फादर जैसा है, ठीक है, वो बहुत प्यारे इंसान थे और मुझे बहुत प्यार देते थे और उनके पास पैसा भी था. सो शी मैरिड टू दिस पर्सन. Obstetric history. First two, there is a miscarriage because of high blood pressure, high blood sugar, sorry. Third is pregnancy, Caesar, पूरा bed rest पे रखा था, male child with a C-section. Fourth pregnancy, twin baby come and death after 4 days because of some complication or because of sugar. She sees that वो मेरे जैसे ही बच्चे थे, एकदम स्वीट गोरे गोरे, और वो दुख मुझे बहुत खा गया, वो बच्चे नहीं रहे वो. फिफ्थ प्रेगनेंसी इज अगेन देयर इज अ सी सेक्शन और 9 months शी इज इन हॉस्पिटल ओनली, ठीक है. और जैसे ही उसको थोड़ा ब्रेथलेसनेस हुआ, उन्होंने सी सेक्शन कर दिया. दिस इज ऑब्स्टेट्रिक हिस्ट्री. तो आफ्टर 10 years of marriage life, husband died suddenly because of brain hemorrhage, and it is very big shock for her. Since like days she cannot come out from her own bed. Okay, वो continuously अपने रूम में ही बंद रहती थी. She didn't do any household work. Taking care of her own children is very difficult for her. At that point of time, her mother-in-law taking whole responsibility. So the whole responsibility is taken by mother-in-law and father-in-law till they die. This part of history is given by her daughter. Now, before 2 years, what happened? After mother-in-law passed away, now the money is like, there is a little bit scarcity of money come, and only house is there with them. So she sold her house because the son want money for business and give all money to son. And in business, her son loses all her money. Okay, and the son leave house or city because of the business loss. Now the scenario is that her daughter is doing, they shifted to a rented house. A daughter is taking care of her right now. So this is the basic information that we get from the case. Now let us analyze part of it. Okay. Interestingly, this is a case which is solely, the remedy is solely decide with the PM understanding. So when we go back to the case, what is a core issue of a person? Okay, क्या कहाँ पे उसको प्रॉब्लम था, या कहाँ पे वो अटक गई, कहाँ पे उसको प्रॉब्लम था. Okay, तो issue of her life is definitely nutritional aspect. So just we can go back and see the core theme of patient. Okay. There is a metabolic disturbance. As we can see, the type 1 diabetes at very early age. It's a metabolic disturbance. There is a sudden separation from a loved one or nutritional provider. Okay. And she's constantly, completely depend for nourishment. For first from like uske father ke paas depend thi, then the husband, then the mother-in-law and father-in-law, and now on her daughter. So we can see whole nutritional line theme. One is nurture. Okay, she wants constant. In this case, she wants constant nurturing. Okay, there is another nutritional line theme is attach and detach. Here we can see the separation from a loved one. Okay, there is a giving and receiving is another theme of nutritional line. In this case, we can see the patient is on receiving mode. She constantly received nurture from other. There is an existential insecurity. Trust and mistrust is a nutritional line theme. There is a digestive and metabolic disturbance, as in this case we can see. So we can clearly see in this case that it is a nutritional line theme. But it is a theme of nutritional line. But what is the role? So she's totally dependent. She's so much passive. She's so much unprepared for her life. There is so much sudden thing happen in her life. Okay? And she's not so much like active in her life. Okay? So we can find it out that it is almost like a womb stage. Okay? जैसे बच्चा वूम में है और उसको कॉन्स्टेंटली न्यूट्रिशन देना पड़ता है, ऐसे ही कहीं ये पूरा केस था. So womb stage theme is she is unprepared, she is quite passive, she is totally dependent. There is the absence of will. Trifle affect her. There is a lot of fear. Everything like कहीं बाहर जाऊंगी कुछ हो जाएगा तो ये नहीं हो जाएगा ये नहीं हो जाएगा. She is so much upset with a little thing. And sudden is one thing which is womb stage theme. कुछ भी सडन होता है वो कोऑप ही नहीं कर पाते वो स्टेज से. सो आई फाइंड इट आउट द कॉलम 4 रो एंड वूम स्टेज थीम. एंड विद दिस अंडरस्टैंडिंग आई कम टू अ थियालिस family. Okay, so there is basically 3 main remedy in thialis family is thea, gamboscia and hypericum. And I choose hypericum as a remedy because it has gangrenous effect, ulcer and wound. And one thing is it's a constantly severe pain जो ये patient feel कर रहा था वो pain कहीं ना कहीं मुझे hypericum में मिला. That is a severe pain. So I give hypericum 200 once in a week, almost like 3 to 4 months I give. And this is the healing process. The person first visit on 10th June 2020, and these are the healing process. So definitely we can see in a photograph there is a ulcer is better. But another very big thing happen is the blood sugar fluctuation. Right now also she is on insulin, but the fluctuation, the fainting part, the breathing issue, the weakness, it is much better. Okay? And what I can see, there is a shift in her life. Now she is taking care of her daughter, which is not possible for her since years. Okay? Now she is handling her life. She is going out in a market. She come to clinic. That was the biggest thing, because every time her daughter come from office uh, and go to her house, and then after उसकी मम्मी को लेके मेरे clinic पे आती थी. So now she's alone coming to clinic, doing household work. Her continuous complaint of pain is better. Now the first time she think that कि अभी मुझे अच्छा होना है, मेरी बच्ची की शादी करनी है. That was the, now she is ready to take a responsibility. So we can see the whole shift in her aspect of life. Thank you, Dr. Mahesh Gandhi, sir, for the beautiful understanding of PEM method. And because of that, I can solve this case. Thank you.